Nicole, I don't hear you.
We're not live yet. Hold on. All right, welcome to our Medicare Minute program for the month of May. It is May the 26th. My name is Nicole Quashiri, and I'm the Family and Consumer Sciences Extension Agent in Bath County. And we have Sasia Hollenberg, your insurance lady. I will let her introduce herself, what she's going to discuss today, and all of that good stuff. So thanks, Sasia, for joining us once again.
Thank you, Nicole. I appreciate having me again here today. And I hope you have a blessed rest of the day. Enjoy the weather. Good afternoon, everybody. I'm gonna introduce myself real quick. My name is Sasia Hollenberg, your insurance lady, and I'm an independent broker here in Kentucky, but I have additional licenses in different states. So if you do have family, or if you move to a different state, I may still help you. Ohio, Tennessee, North Carolina, Idaho, Virginia, Michigan, Florida, West Virginia. These are all just a few options I can serve. I love to help people, especially on the Medicare side. But in general, not only that, I also do under 65. So if you have, for example, a spouse who's younger, who needs some help there, I'm more than glad to help there too. My background is actually in management. I have managed several different companies, but I really, really fell in love helping folks, and this business is just wonderful to, when you can detect things and help people and support. I live in P-Sticks here in beautiful Kentucky. I'm originally, you hear this in my accent, from Germany, and I grew up in Bavaria, so I'm a mountain girl. And we live here on a small farm. We have a couple of horses, 3 rescue dogs, and a ton of chickens. And I love to garden, when I have time, reading books and knitting, and sure enough, riding my horses. So here's just a few impressions you might want to share here. I share here a little bit of my personal life. You see here my horses, a beautiful view here in Kentucky. And I hope you guys enjoy the weather right now. I mean, it's just absolutely gorgeous. And a couple testimonies from clients who were very satisfied with what I was able to help. Now, today's subject will be Medicare supplements. First of all, I would like to make sure you understand the difference, because that is what I hear a lot is when I see a client comes to me and says, I have a supplement, but they actually have a Medicare Advantage plan. So there is a difference. So a supplement is literally supplementing Medicare versus a Medicare Advantage plan is original Medicare provided by private insurance companies. Medicare Advantage plans, they are changing every year, and it is controlled by Center of Medicare, while Medicare supplements, they always stay the same. So you get always the same service. So let's dig a little bit deeper into this. So today's agenda, we're gonna have following subjects. What are Medicare supplements? What do they cover? How much do they cost? And when can I buy them? So Medicare supplement plans are also called Medigap plans. They're sold by private insurance companies. And I will tell you, I have probably 20 different carriers available. I have a bunch of different options. So if a client likes a certain company to work with, I probably can help. Or a client says, you know what, I really had a bad experience here. I'm not going to go with that company. And that is fine. Other reasons might be there too. So I just wanted to, assure you, I will not push one company at you or on you. I will give you an option. Typical, I like to give my clients 5, 6 different options, and then you can pick and choose. And I'm more than glad to help with that. Now, These Medicare supplements are designed to fill the gaps of original Medicare Part A and B, like a boy. They have nothing to do with a drug plan. That is another thing what I hear a lot, that clients are saying, oh, my supplement is such a bad supplement. It is not doing anything for my drugs. It doesn't, because you will need a separate drug plan. Medicare supplements are not covering anything in concerns of your prescriptions. Now, here are some good news. You can see pretty much any doctor or any hospital that participates in Medicare in the United States. That is very important. Specifically, what I have seen in my office, that I have clients, they would like to have cancer treatment, for example, in Florida. Excellent hospitals there. Or they would like to go to Cleveland Clinic for, heart surgery. That is all possible. Now, again, please be aware, Medicare supplements only work if Medicare pays something, okay? There are exceptions to the rules, but in general, that means if you are with a doctor or in the hospital, which does not accept Medicare, a supplement will not work either, okay? It is supplementing Medicare. There are 10 standardized plans. Now, there is always exceptions to the rules. There are a few states, they are accepted from this standardized plans. We're not going to go too much into depth with these exceptions, because I know most of us here are in Kentucky, and I want to make sure that we're covering us here in Kentucky. So following gaps we have on Medicare Part A, and I'm pretty sure most of you know that. First of all, there is an inpatient deductible, and I'm not going to bore you with all the numbers. That is just the rule of thumb. There is copays for inpatient stays longer than 61 days. They are fairly hefty. There's also skilled nursing facility co-insurances between 21 day and 100 days. Now, here again, I would like to point out, after 100 days on the skilled nursing facility, Medicare is not paying at all anymore, which means a supplement will not help. But up to 100 days, the supplement will help cover this gap. For longer stays in skilled nursing, yes, everybody heard about the long-term care policies out there. Everybody is gun shy because they're very expensive. I do offer some plans. They're called recovery care plans. They at least cover for another year. And that might help a little bit out too. So these are things we can address in a personal conversation if you have needs for that. Hospice copay is another gap for Medicare Part A and the first 3 pints of blood. So here are the gaps for Part B. That is called the outpatient portion. There is an annual deductible for Part B, 20% co-insurances, and the Part B excess charges. What are excess charges? So any specialist can charge up to 15% more than what Medicare approves. This is called an excess charge. Other gaps are foreign travel, additional home health care, and preventative services. So this is a general overview real quick over national options on different Medicare supplements. We have Plan A, B, C, F, K, L, M. So first of all, this is another thing what I see a lot that people mix up. Oh, I have Medicare Part A and B. I have a supplement Part A. This is different. Okay, so we're gonna have supplement A, B, D like dog, and we have original Medicare Part A, Part B, Part D. So the wording is confusing, very confusing. I see it just too often. This is a general overview. We're going to dig into a few plans. I'm not going to go through all of those because you're going to shoot me through the screen. But typically, What I normally recommend is G or N plan. We can definitely look at a couple other options. But this is pretty much the majority. Now, two plans, K and L, they have an out-of-pocket limit. And that is for 2021 for the K plan, $6,220, and for the L plan, $3,110. So let's talk about plans F and G. These are plan F, pretty much as you can see here in the chart, will cover all the gaps we already addressed prior. Now, coverage for Part B deductible is only allowed for individuals that turn 65 before January 1st, 2020, or were on Medicare beforehand. These plans are also available as high deductible plans. So currently, if you're turning 65 now, you would not be eligible for a S plan. That is why I said before, I would recommend to think about Plan G or N. Since January 1st, 2020, the Part B deductible has to be paid by the client. So let's see. Oh, my screen forward is not working. We have what I already mentioned before, the plans K and L. We have here quite a bit out of pocket expenses. So under these circumstances, we can run the numbers, but typically it is actually sometimes better to go with the Medicare Advantage plan instead of going with one of these plans. If we have, for example, a Medicare Advantage plan with an out-of-pocket maximum under a certain limit. I just wanted to bring that up. So we need to play a little bit about your needs. We need to see a little bit what your comfort zone is. So it's a very personal situation. So it's not cut and dry for every person. Every person has different needs and has different opinions and requirements. So that's why I really like to have an individual conversation. But this is just more for you to have a little bit of an overview. So then there are select Medigap plans. They're called, for example, Plan G Select. That will require you to use a hospital or doctors in a certain network. Normally, all the Medicare supplement plans do not have a network. That is the beauty. That is why I recommend, when you want the freedom to do whatever you want to do, wherever you want to go and want to have the treatments wherever you want to need it, to go with the supplement. Now, the select plans will put a little damper on there so you can see your doctors, but in general, the hospitals will have a network, okay? Now, if you're pretty clear and you say, who cares, you know, I stay here in Kentucky, I only go to hospital XYZ, the hospital XYZ is in the network, we definitely can look into a select plan. Now, all these plans available are specific by zip code, and they allow to change the plans if you move outside of the service area. So what are the costs? And again, it's very hard for me to give you any kind of exact numbers because it really depends on your age, if you're smoking, if you're aging in what zip code, which state you're living. But in general, there are somewhere, I would say they start somewhere, and then what plan you're thinking about too. So depending on somewhere between $80 and $120, $130. But this is when you just turn 65. So this is just an approximately. So I really don't want to put any numbers on it because it is very, again, depending on a lot of details. Generally, lower benefits means also lower premiums, and higher benefits obviously mean higher premiums. Premiums can vary based on your age, your gender, your zip code, your health conditions, and tobacco use. Again, there are always exceptions to the rules. So attained age policies are policies where the premiums are based on your age, your gender, your zip code, your tobacco use, possibly health conditions. There is a couple, again, exceptions to the rules. They increase each year as you age, and premiums can change when the company decides to do a rate adjustment for all policyholders. So here's another thing, what I hear quite a bit is like, oh, I had XYZ happening this last year, my premium is going up. It has nothing to do with your specific scenario. If these companies do a rate increase, it will be for all policyholders and not just for you. Then we have issue age policies. Here, the premiums are based on your agent, what the agent did quote you when you first purchased the policies. And that was then, again, according to your policy zip code, your tobacco status. These premiums, again, can change when the company is a rate adjustment for the entire book, and not just for you. Then there is a third variety, and that is called community rated policies. These premiums are the same for all policyholders, regardless of gender or age. The premiums do vary by zip code, tobacco use, or health conditions, and the premiums can change again when the company adjusts rates for all the policyholders. So here is something specifically, I know everybody is hearing from October 1st on these endless commercials from Joe Namath or other people, and it's running pretty much nonstop, driving you crazy. So you think you can only do this during this annual enrollment period. That is not right for supplements. So when can you buy a supplement? There is, first of all, it's called an open enrollment period, 6 months starting when you turn 65, or sign up for Part B. You can choose any plan with any carrier, and you cannot be denied due to health history. So when you turn 65, you pretty much have a carte blanche at that point. It doesn't matter. There will be no health questions asked. So let's just say you have cancer, you're turning 65 and you're so concerned, I really would like to have a supplement plan because the cancer treatments are so expensive. That is not going to be a problem because you're turning 65, it's open enrollment, there will be no health questions asked. If you have questions in general on these subjects, please feel free to give me a call, PM, or text me, and I will be more than glad to help you. So then there is guaranteed issue. These situations are when you have a right to buy a policy and your acceptance is guaranteed. The examples here are, let's just say you have a group insurance through your employer and that plan ends because you decided to quit your job, you want to retire, or you have, for example, it happens every few years, one or two leave the area. A Medicare Advantage plan is actually leaving the area. So a Medicare Advantage plan says by the end of the year, we will not renew our contract, we're leaving the area. You will have a guaranteed issue right to be in a Medicare supplement. A third one is you move out of the service area of a Medicare Advantage plan. And there will be also a few other scenarios, where I can maybe guide you and say, hey, yeah, here we have a guaranteed issue scenario. Now, the other way to get a Medicare supplement is through underwriting. Everybody is there a little worried and says, oh, I have some high blood pressure, a little bit this, a little bit that. Oh, I had a heart stent done 5 years ago. I guarantee they will not take me. Give me a try and let's see what we can do. There are different companies out there, different underwriting scenarios where we can look into. Okay, you can apply for a policy literally any time during the year. You do not have to wait till annual enrollment, as long as you can pass medical underwriting. This is going to be a series of yes and no questions, which I will ask you. You will have probably some questions about your prescriptions you're taking currently or have taken in the last few years. And some companies require a phone interview, which again will be pretty similar to the questions which I already asked you. Now, what I always recommend, and this is a big note, do never ever cancel your current coverage until the new coverage is in place and has been approved. That is just something I never want to have that happen, that a client will be because of a mistake like that without any medical coverage. So that is one big note. I always say, hey, be careful. So there are some special state provisions, and California is one of them. There is an annual enrollment lasting 90 days, beginning 30 days before and 60 days after your 65th birthday, where you can replace any Medicare supplement policy with a policy of equal or lesser benefits. Connecticut, New York, and Vermont have a year-round open enrollment. There are other special state provisions like Missouri, where individuals who terminate a Medicare supplement policy within 30 days of the annual anniversary date can obtain the exact same plan with no health questions asked from a different insurer that offers the same plan. And Oregon has an annual open enrollment lasting 60 days, beginning 30 days before and ending 30 days after your birthday, where you can replace any Medicare supplement policy with the policy of equal or lesser value benefits. Now, under 65, you're under 65. First of all, I can help you under 65 if you're not on Medicare. I can definitely help you there. I am certified to do Affordable Care Act plans and other options too. But for folks who are under 65 and on Medicare, some states are offering also plans to individuals who qualify for Medicare due to disability or specific diseases and are under age of 65. Now, the plans will be limited, I will tell you that, and certain time restrictions are applying. And I also will tell you these plans under 65, when you're on Medicare, are fairly expensive. Now, if you are under 65 and not on Medicare, we have a lot of different options and maybe also some help for you where you're going to be surprised how reasonable health insurance can be. So in general, Medicare supplements are guaranteed renewable. So the insurance carriers cannot cancel your policy for any reason as long as you pay your premium. So what I hear a lot is, man, I was so sick this year. I hope they're not going to cancel me. That's not going to happen. Okay. Now, the portability is actually one of the biggest reasons why a lot of my clients are purchasing the Medicare supplements. You can move from state to state. You can use your doctors in other states. You have a lot of more flexibility. And carriers cannot single you out for a rate increase or cancel your policy based on your health conditions. Prescription drug coverage. Medicare supplement policyholders must have a standalone prescription drug coverage to cover their outpatient prescription drugs. As I said that before, I hear that again and again. Well, my supplement is not doing anything. It sucks for my prescriptions. It is not covering your prescriptions. You do have to have a separate prescription plan. We currently have about over 20 different prescription plans in the state of Kentucky, and I'm sure we're going to find one which matches your specific needs. Now, if you do have questions, Feel free again to call me, text me, send a PM. We will post this later on the Bath County Extension site, so you can rewatch that at a later point. And I really appreciate your time today to attend the meeting. And I hope you guys enjoy it. It looks like we might get some rain and get some the dust out of our air. My phone number is 859-294-7490. If you want to just ask me some questions, if you want to just say, hey, listen, I'm turning 65 in a half year, or I am 65 and I'm still working, I'm planning to retire in a year, what am I doing? I'm more than glad to sit down with you and put a game plan together. Thank you again. I appreciate it. You have a wonderful and blessed day, and I see you next month.
Thank you, Sasia. See you later.
Hi. Good.
Yeah. See you next time.
See you next time. Take care, and thank you for having me.